We're talking with Dr. Gene Overholt, board-certified gastroenterologist. That's a stomach specialist. We're going to be talking about the old stomach nemesis. Gene, welcome to the Dr. Bob Show.
Bob, it's great to be back.
Always nice to have my brother here on the show. Always very proud of you, and as I tell everybody, you're my hero. I want you to know that.
Okay.
Tell me about cancer of the esophagus. How common is it?
Well, the numbers are there are 16,000 new cases every year, but it's an increasing cancer, and in fact, it's increasing more rapidly than any other cancer in men and women throughout the world.
So it's terribly important. Is one of the symptoms of cancer of the esophagus heartburn?
Heartburn is a symptom of acid reflux coming back up into the esophagus, and it can burn the lining, giving you the symptom of heartburn. It's one of the causes of esophageal cancer.
I've got you. Tell me about gastric cancer. How common is it?
The numbers are there are 21,000 new cases expected each year. The incidence is declining gradually throughout the United States and the world as we treat this bacteria called H. pylori.
Helicobacter?
Helicobacter pylori, yes.
Is heartburn one of the symptoms of gastric cancer?
Heartburn classically refers to burning sensation in the chest. So it's not the symptom of a gastric cancer. What we call burning in the pit of your stomach or dyspepsia are symptoms that are compatible with gastric cancer.
Is heartburn and dyspepsia the same thing? Let's clarify that right now. I call it heartburn and acid indigestion. The GI guy calls it dyspepsia?
No, heartburn and acid indigestion is up here. Dyspepsia can refer to the stomach. Bloated feeling, burning in the stomach, discomfort after you eat, various types of symptoms, but it's more in this area. Some people say dyspepsia refers to everything, but classically heartburn's up here, dyspepsia is down here.
Tell me about peptic ulcer disease. Now, a symptom of that is dyspepsia. What is peptic ulcer disease, and what's the new findings there?
Peptic ulcer disease refers to ulcers or sores in the stomach or the first part of the small intestine or in the esophagus. And it can be due to multiple causes. It can be due to acid, too much acid, and your stomach lining can't handle it. It can be due to the Helicobacter pylori. It can be due to medication. Sometimes we don't know what it's caused from.
How do you find out if somebody's got heartburn, acid indigestion, dyspepsia, and you take a history and they've got heartburn, acid indigestion? How do you make the diagnosis?
Well, the first thing you just said was you take a right kind of history and a physical examination. And the most sensitive test to diagnosis is where we look down with the scope and we can actually see the lining of the esophagus and the stomach.
That really clarifies the whole picture, really, doesn't, when you can do that?
Yes, it's just like looking at you. It's very clear.
Tell me, if you make the diagnosis, if you look down, how do you make the diagnosis of Helicobacter?
You have to do it with a biopsy. You look down, you have a little micro probe that goes through the scope. You can take a biopsy and send that to the pathologist, and they can tell you whether the bacteria is there. Or you can do what's called a breath test, whereby you drink something, a little clear solution that has a radioactive material, and that is metabolized and gets into the breath, and you can measure that.
So you've got a couple of ways, biopsy and a breath test, to make that diagnosis. Treatment of Helicobacter causing ulcers.
Very important thing to do, because if you treat the bacteria, you can often heal the ulcer completely. The treatment is a combination of antibiotics, usually 3, plus a medicine to stop the acid secretion. So it's 2 phases, antibiotics, acid suppression.
How long is the treatment?
2 weeks in general for most people. May need to be repeated, but 2 weeks.
And if somebody's having chronic recurrent ulcers and they have this antibiotic treatment, how often before you have to repeat it? Every 6 weeks, once a year, every 3 years?
Well, you get a cure rate in the majority of people, but it can recur. And if it does, you have to treat it again with different combination of drugs.
Why do you think it recurs? Hard to know.
I can't answer that with
Assurance.
reliably, but it's probably due to you did not kill the bacteria completely the first time and it regrows.
The fact that in the United States people use antibiotics frequently, does that mean the incidence of ulcers will be going down normally if it's due to a bacteria?
No, it won't. The bacteria that causes ulcers embeds into the lining of the stomach. It secretes a little chemical to buffer the acid so it can live in the environment of the stomach. Ordinary antibiotics don't get it. Combination of 3 antibiotics and acid suppression will take care of it.
Gene, let's talk about reflux disease. That's called what?
GERD, gastroesophageal reflux disease, which is a term that describes acid flowing back up into the esophagus and injuring the lining, causing burning.
Does that damage the esophagus?
Yes, either the food, but primarily the acid will injure the lining. It will heal, and then it gets re-injured, and over a period of time, the lining becomes more acid resistant. That is what we call Barrett's esophagus, which is a precancerous condition. So heartburn is a very serious symptom.
And needs to be looked at very carefully to
Yes.
find out if it's ulcers or if it's reflux disease, if it's GERD. Is there good treatment for GERD?
Yes, it is. There are a number of treatments. One is lifestyle changes. Wait, don't eat late at night, elevate the head of your bed to use gravity to keep acid in your stomach.
Well, if you elevate the head of the bed, how much?
It depends. If you're slim like you are, 2 inches is plenty. If you're overweight, 4 inches.
Okay, and how do you elevate the head of your bed without sliding down?
If you have it at 4 inches, you're going to slide down some, so you just might as well get used to that. You can put a footboard and it'll hold you in bed, but you're going to slide.
Okay, so lifestyle changes, reduce weight, elevate the head of the bed. What about certain kind of foods? Are they worse?
Certain foods will bother certain people. Spicy foods, chocolate, too much coffee, certain foods like that will bother people. And you just have to find out what triggers your symptoms and avoid those.
Medicines?
Medicines, some heart medicines, all sorts of types of medicines can aggravate reflux, but NSAIDs are probably the worst.
And because NSAIDs are the ibuprofen medicines, even aspirin, those sort of things. Now, how about medicines for treatment of GERD, though? How do you treat the GERD, lifestyle changes, and what medicines do you use?
There are 2 types of medicine. One is called an H2 or a histamine blocker, and it's fairly effective. That's the old Zantac and Tagamet and those things. The new ones that have been around 10 or 15 years are the PPIs, or proton pump inhibitors, like Nexium and Prevacid and Protonix and Acifex.
When you take those medicines, the proton pump inhibitor, well, which is best, the H2 blocker or proton pump inhibitor?
Proton pump inhibitor is much stronger and much better.
1 minute, the NSAIDs, the ibuprofen type medications, the aspirin medications that irritate the stomach, how do you treat that?
You can take NSAIDs or aspirin and take a PPI inhibitor and probably protect yourself. But if you're going to take it without that, the best thing to do, probably the best thing anyway, is to take it with food. Take the arthritis medicine with food.
Low dose aspirin for heart disease, you know, a baby aspirin. Is a baby aspirin a baby on the stomach, or it can be a big daddy?
You can still see ulcers and erosions from baby aspirin.
So you have to be careful with all medicines. Discuss those with your doctor.
All medicine, good advice, discuss them. If you take a baby aspirin and you have dyspepsia or an upset stomach, check with your physician.
Dr. Gene, thank you so much for coming to the Dr. Bob Show. You're always a great guest, and I love having you on my show.
And I love being here.